This is our next track is really talking about Lean Six Sigma and focusing on the stakes getting higher with the change that's occurring within healthcare. Our presenter is John Kramer, who's the Director of Organizational Effectiveness at Lean Six Sigma at Memorial Hermann Healthcare System. He has 11 years of experience in quality and process improvement, and he's directing business operations and looking at efficiency and quality throughout his organization. The other thing is that he has quite a bit of experience in IT, and then prior to that he has experience in being a music composition and doing violin. Very interesting background. He has a certified Six Sigma Master Black Belt and will be telling us a little bit about how he's been doing this work throughout Hermann and his organization. Thank you.
Thanks, Kevin. Boy, I don't know about you, but my head is swimming with all the information from so much, and I've been taking notes feverishly. You know, I'm sort of the young baby boomer where I love the toys and gadgets, but I still prefer paper, so I'm still writing on the notepads. I also recognize that the challenge I have right now is that the only thing standing in between you and lunch is me. And so I want to make sure that our time is really well spent so that you don't leave here thinking I could have had lunch early. Let me ask, I want to do a reality check here because this is my first WCBF event here with healthcare and Six Sigma. How many of you are practitioners of Lean or Six Sigma or both? Actually, okay. How many of you started out in healthcare first before you learned Lean and Six Sigma? Okay, very good. How many of you started off or had a previous experience with process improvement and came into healthcare later? All right, and I'm in that camp. I've been, even though I thought I straddled the fence because I spent 10 years working at Cigna, which is a large healthcare insurer. But when you talk to hospital folks, they'll quickly correct you that that's not healthcare. And so when I came to Memorial Hermann about 3.5 years ago, I went through the typical hazing by the medical staff when I went to meet the physicians. And actually Guido talked a little bit about that in terms of the credentials, how you're looked at by, and viewed by peers. I remember the one doctor in particular at CMO had asked me, I introduced myself. He said, "Now, is that Dr. Kramer?" I said, "No, Mr. Kramer." "I see. Do you have a clinical background?" "No, I don't." "I see. Did you do any work in research and laboratory work?" I said, "Well, I used to play Mozart for a living, so that didn't really go over too well in terms of how I was able to, come across it with some, and that actually was a challenge. And in that particular situation, it turned out to be that the doctor I was talking to was a lover of music, and he got more excited about my music background than about what I really wanted to talk to him about, which was some new opportunities in terms of sepsis identification. So what I want to be able to do with you is talk a little bit about the journey that Memorial Hermann in Houston, Texas has taken regarding its Lean Six Sigma program, and honestly how we've had to adapt and expand what we do to stay relevant and to continue to provide value. A little bit about who we are. We have 10 acute care hospitals. We are the largest healthcare system in the Houston metropolitan area. We also have an array of rehabilitative outpatient services. We do a lot with sports injury and sports medicine. And we have ambulatory surgery centers and outpatient imaging centers. So we're pretty much viewed as like the Starbucks of Houston because we have hospitals in virtually every corner of the city. Here are some quick stats and facts. And again, I think one thing I would like to note is that our trauma center is the busiest trauma center in the U.S. It became even busier after Hurricane Ike came in and pretty much wiped out the trauma center in Galveston. So the city of Houston and Galveston, between them, only had 2 level 1 trauma centers in that area. Now I understand they're actually we'll be back to 3. And we were the first hospital system to incorporate life flight helicopters, and that was Dr. Red Duke who introduced them. Our environment is, as best to describe it, is confederated. In other words, we are not a highly centralized medical system. We do have a shared system services area, corporate structure, but by design, the facilities are semi-autonomous. They run, and it was done because we do have a teaching facility at the medical center, the Texas Medical Center, but we have community-based hospitals, the strategy being that each hospital can focus squarely on the unique needs of the community in their area. Now that, let's face it, from a Lean Six Sigma perspective, creates quite a challenge when you are looking at 9 or 10 different ways of doing the same thing across the system, and how you can then, in an organization that's not even truly centralized, to try to get folks to adopt and to embrace standardization, especially when it